If you take a walk around in any public area, the airport, shopping malls, and even on public transport, you're bound to run into someone wearing a surgical face mask now. Ask them why they're wearing one, and they'll tell you that it's to protect themselves, of course. But should healthy people wear them in the first place? Dr. Kao Ken Seong is a specialist at Sunway Medical Center, and he has a surprising answer to this question.
The simple answer is that a healthy person should not wear a mask at this point. The reason is that this surgical three-ply mask is actually designed to prevent someone who's sick from spreading the germs to everyone. Okay, when we are sick, we tend to cough and we tend to sneeze. And the mucus and the saliva can contain all these viruses, which is then expelled into the air and spread to people around us, making them sick. So the surgical mask is actually designed to prevent these germs from being spread to people around the sick person. Okay, so we have to bear in mind that a surgical three-ply mask has not been proven to effectively prevent someone from getting a viral infection. For example, like the novel coronavirus. There's good evidence that N95 respirator is better at preventing someone from getting the novel coronavirus. But at this point in time, I do not encourage the public to use it. The N95 mask is a thicker mask compared to the surgical three-ply mask, so it increases the work of breathing. All right? And it's not easy to use. It can get very hot and moist inside the N95 respirator. So we have to be aware that at this point in time, the public shouldn't, panic and start using the N95 respirator.
So if wearing a surgical three-ply mask wouldn't protect you, then what will? Dr. Kao say it's simple hand hygiene.
So I think we have to be practical. At this point in time, if we are talking about trying to prevent infections, I think hand hygiene is something that we should encourage people to do. So we practice washing our hands after we have touched certain surfaces such as doorknobs, car handles, or surfaces of tables and walls and so on. I think before we touch our mouth or nose, we should wash our hands. All right. The other thing is that we should also avoid touching our mouth or nose as much as we can. All right.
Another thing you should avoid using are public restroom hand dryers. Dr. Kao says studies have shown they actually spread more germs, and the public should use paper towels if they are provided instead. High-risk individuals, such as those aged 65 and above, and young children should avoid crowded places. If you really do want to wear a face mask, Dr. Kao says it is important to not touch it once you wear it or take it off unless you want to change the mask.
The common mistake about using a mask is that we have to remember that there are two sides to the mask, all right? The white side and also the blue or green side. The filter is located on the white side, all right? Is this filter that prevents someone who's sick from spreading their germs. So when you're sick and you're using the surgical three-ply mask, make sure that the white side is facing your face and the blue or green side is actually facing outwards. So this will effectively prevent any droplets from escaping into the air around you and prevents infecting other people.
You've probably seen people do this. They take off their face mask and then they hang it under their chin or even place it on the table. So what happens when you do this? You're actually contaminating the filter on the mask with the germs under your chin or even on the surfaces that you touch, like the table.
So that's a wrong way to use your mask. Basically, when you have placed the mask to cover both your mouth and your nose, you shouldn't touch it. Okay? If you have touched it, for example, like what you say, pull it down to your chin, then you should replace the mask. Okay, because the mask is now, so to speak, contaminated. It's no longer very effective. I think one of the other common mistake that we make with regards to using all these surgical three-ply masks is that we don't change it. All right. So one of the basic tenet is that you can only use a mask for maybe about 8 hours. Then you should replace it. Okay, because it gets moist and it gets less effective.
In a hospital, the staff wear a mask as they are in close proximity of those who are sick, and they change the mask every time they go on break. So try not to touch the mask once you wear it, and if you do, change it. I spoke to a local manufacturer of surgical face masks. He told me that health officials are literally lining up outside his door to ask for more stock. So when there's panic buying and healthy people are actually hoarding the mask, that means those who really should wear it, those who are sick, they can't get to the mask. What is more important for healthy people is to wash your hands frequently. If you can't wash your hand, at least use hand sanitizers. Wee Beng Chiang for 7 Edition.